Hello everybody, welcome to the ENT video series. And today we will go with video number 5, that is anatomy of the larynx. It's a very important topic and the anatomy is also quite difficult to understand. So let's get started. So the larynx, it lies ahead of the hypophyllus and it covers the region from cervical 3 to cervical 6 vertebra. That is, in adults, the larynx ends at the lower level of the cervical 6 vertebra. And the larynx can be moved vertically as well as it actually moves vertically and in anterior-posterior direction during phonation and swallowing. Moreover, we can also move the larynx against the cervical vertebra, which lies in its posterior aspect, producing a particular grating sensation, which is known as the laryngeal crepitus. Coming to the laryngeal framework, first we will talk about the laryngeal cartilages. So, we need to know that there are 3 paired cartilage and 3 unpaired cartilage. The 3 paired cartilages are the arytenoid, corniculate, and the cuneiform, while the unpaired cartilages are the thyroid, the cricoid, and the epiglottis. And the thyroid cartilage is largest of all the cartilages. It consists of 2 ala which are joined together anteriorly to meet and make an angle, which in cases of males it is around 90 degree and in cases of females it is approximately 120 degree. And the vocal cords are attached at the middle of this thyroid angle. Foreign bodies are usually lodged above the vocal cords in this aspect of the thyroid cartilage, and which can be actually removed, or to maintain an effective airway we need to go through a procedure to remove this foreign body, which is known as the cricothyroidectomy, by piercing the cricothyroid membrane. Thyroid cartilage, it has got 2 cornua, that is the superior cornua and 2 inferior cornua. The cricoid is the only cartilage which consists of a complete ring. Anteriorly, it is in the form of an arch, while posteriorly, it is broadened to form a lamina. The epiglottis is a yellow elastic cartilage forming the anterior wall of the laryngeal inlet. It is attached to the hyoid bone by a ligament which is known as the hyoepiglottic ligament, which divides it into the suprahyoid and the infrahyoid epiglottis. The epiglottis has got a stalk which is known as the petiole, by which it is attached to the thyroid cartilage just above to the attachment of the vocal cords. The anterior surface of the epiglottis is separated from the thyrohyoid membrane and the upper part of the thyroid cartilage by a potential space filled with fat, which is known as the pre-epiglottis space of Boyer. Now, this space is important because the space may be invaded in carcinoma of the supraglottic larynx or the base of the tongue. Posterior surface of the epiglottis, it is concavo-convex, means the anterior part is concave while the posterior part is convex, having a particular bulge which is known as the tubercle of the epiglottis, and because of this the view of the anterior commissure is obstructed while we perform procedures like laryngoscopy. Epiglottic cartilage shows certain pits which might lodge the mucous glands, and it may also have certain perforations through which there is a direct route of communication from the laryngeal surface of the epiglottis to the pre-epiglottic space, and this is how the carcinoma of supraglottic larynx or the base of the tongue can easily invade into the pre-epiglottic space of Boyer. The arytenoid cartilages, they are pyramidal in shape with the base directed towards the cricoid cartilage. They are paired. It has got a base which articulates with the cricoid cartilage, and it has got a lateral process which is known as the muscular process, giving attachment to the intrinsic laryngeal muscles, and directed anteriorly is a vocal process which gives attachment to the vocal cord, whereas the apex supports the corniculate cartilage. Corniculate cartilage or corniculate cartilage of Santorini, they are, as I have said, they lies over the arytenoid cartilage. The corniculate cartilages are paired and they articulate with the apex of the arytenoid cartilage. The cuneiform cartilages of Willisburg, They lie somewhere in the arytenoid folds, and they give passive support to these folds and lying in front of the corniculate cartilage. Here we need to know that the thyroid, the cricoid, and the arytenoid, those are hyaline cartilages, while the epiglottis, the cuneiform, and the corniculate, they are elastic fibrocartilages, and the hyaline cartilages stay around ossify. The ossification starts at the age of around 25 years and it is completed by 65 years of age. The calcification of these cartilages may be confused with foreign bodies, any foreign bodies in the esophagus or the larynx on X-rays. Talking about the cricoarytenoid joint, it is a synovial joint, and this joint, it is formed by the base of the arytenoid with a facet lying on the upper border of the cricoid, and it has got two kinds of movement. One is the rotatory and other one is the gliding movement. The rotatory movement is by the movement of the arytenoid on the cricoid around the vertical axis, which results in the abduction or the adduction of the vocal cords, while another movement is the gliding movements, which helps in the bringing the posterior end of the glottis towards or away from each other. Another one is the cricothyroid joint. This is also a synovial joint, and this is formed by the inferior cornua of the thyroid cartilage with a facet on the cricoid cartilage lying inferiorly, and the joint has its movement on the transverse axis. Here I would like to say that if you are interested in my videos on ENT learning videos, you can just subscribe onto my channel, Dr. O'Brien Laryngeologist, and for getting more information on such ENT videos, go to the laryngeal membranes and the ligaments. Now, while we talk about membranes and ligaments, we come across two terms, intrinsic and extrinsic. So what do we mean by them? The extrinsic means when it is joined to, when they are connected to the structures not attached to the larynx, for example, to the hyoid or the trachea. Whereas if it is between the structures of between the components of the larynx, it is known as the intrinsic. First, the extrinsic membranes and the ligaments. So the first extrinsic membrane is the thyrohyoid membrane. It connects the thyroid cartilage to the hyoid bone, and it is pierced by the superior laryngeal vessels and the internal laryngeal nerve. Next is the cricotracheal membrane. It connects the cricoid cartilage to the first tracheal ring. The third is the hyoepiglottic ligament. That is, it connects the epiglottis to the hyoid bone. The intrinsic membranes or ligaments, the first is the cricovocal ligament. It is triangular fibroelastic membrane, and it stretches from its upper border is free, and which stretches from the middle of the thyroid cartilage to the vocal process of the arytenoid, forming the cricovocal ligament. And while its lower border, its lower part is attached to the arch of the cricoid cartilage, and the lower attachment, it stretches medially on both the sides together, forming the conus elasticus. And it is this region in the subglottis where sometimes foreign bodies get impacted. Next is the quadrangular membrane. The quadrangular membrane, it is actually not well defined. It stretches between the epiglottis and the arytenoid cartilages. It lies deep to the mucosa of the aryepiglottic fold, and its lower part, that is the lower border, it forms the vestibular ligament of the false chord. The cricothyroid ligament, the anterior part of the cricothyroid membrane is thickened to form this ligament, while the lateral part, it forms the cricovocal membrane. The thyroepiglottic ligament, it attaches the thyroid cartilage to the epiglottis. Talking about the muscles of the larynx, here also it is of two types, the intrinsic muscles and the extrinsic muscles. So intrinsic muscles are those which attaches the laryngeal cartilages with each other, while extrinsic muscles are those which attaches the larynx to the surrounding structures. The first is the intrinsic muscles. The intrinsic muscles, they are of two types, that is, they can act on the vocal cord or they can act on the laryngeal inlet. So what are the muscles which acts on the vocal cord? They are the abductors, the adductors and the tensors. The abductor is the posterior cricoarytenoid. Adductors are the lateral cricoarytenoid, interarytenoid, and the thyroarytenoid external part. The tensors are the cricothyroid and the thyroarytenoid internal part, that is also known as the vocalis muscle. The extrinsic muscles of the larynx, as I have said, they connect the larynx to the surrounding structures and causing their elevation or depression. Elevators are two types, primary elevators and the secondary elevators. Primary elevators, they act directly as they are attached to the thyroid cartilage, and they include stylopharynges, salpingopharynges, palatopharynges, and thyrohyoid. Secondary elevators act indirectly as they are attached to the hyoid bone, and they include stylohyoid, mylohyoid, geniohyoid, and the digastric. The depressors are on the Y are the sternohyoid, the sternothyroid, and the omohyoid. Talking about the laryngeal cavities, the laryngeal cavity starts at the laryngeal inlet, where it communicates with the pharynx and ends at the lower border of the cricoid cartilage, where it is continuous with the lumen of the trachea. Here we need to know that two pairs of holes divide the cavity into three parts. They are the vestibule, ventricle, and the subglottis. Talking about the parts one by one, first is the inlet of the larynx. The inlet of the larynx, it is formed with an oblique space which is formed anteriorly by the epiglottis, on the sides by the aryepiglottic fold, and posteriorly by the interarytenoid. Next is the vestibule. It extends from the laryngeal inlet to the vestibular folds. This is bounded by the posterior part of the epiglottis anteriorly, the aryepiglottic folds at the sides, and posteriorly by the arytenoids. Next is the ventricle. It is a deep elliptical space bounded between the ventricles above and the vestibular folds above and the vocal folds below. The saccule is a diverticulum of the mucous membrane which extends from the anterior part of the ventricle into sometimes upwards into the vestibular folds and also laterally towards the thyroid cartilage. When abnormally enlarged and distended, it may form an air-containing sac which is known as laryngeal seal, and it might present in the neck externally. There are many mucous glands in the saccule which actually helps to lubricate the vocal cords. Next is the subglottic space or the infraglottic larynx. It extends from the lower border of the vocal cords to the lower border of the cricoid cartilage. Next, let us talk about the vestibular fold, that is the false vocal cord, and the vocal folds or the true vocal cord. So first is the vestibular fold or the false vocal cord. The vestibular fold is a fold of mucous membrane and extending anterior posteriorly along the laryngeal cavity. What does it contain? It contains vestibular ligament, it contains few fibers of the thyroarytenoidus muscle, and mucous glands. Talking about the true vocal folds or the vocal cord, they are pearly white sharp bends extending from the middle of the thyroid cartilage to the vocal process of the arytenoids, and it contains what? It contains the cricovocal ligament. The rima glottitis or the glottis, it is an elongated space between the vocal cords anteriorly and the vocal process and the base of the arytenoid posteriorly. Anteroposteriorly, it is around 24 mm in men and 16 mm in women. And the anterior 2/3 of the vocal folds, it is membranous, while the posterior 1/3, it is formed by the vocal process of the arytenoid. The glottis is the narrowest part of the laryngeal cavity. Anterior 2/3 of the glottis, it is concerned with phonation, and it is as such it is known as the phonatory glottis, while the posterior 1/3 is associated with respiration, and it is known as the respiratory glottis. Talking about the mucous membrane of the larynx, the epithelium over the mucous membrane is actually serrated columnar except over the vocal folds and the anterior part of the vestibule where it is actually stratified squamous epithelium. Lymphatic drainage, the supraglottic larynx above the vocal cords is drained by the lymphatics which pierce the thyrohyoid membrane and drain into the upper deep cervical lymph nodes, while the infraglottic larynx and infraglottic larynx of the vocal cords, they actually pierce the Cricothyroid membrane to drain into the pre-air group of. Talking about the laryngeal nerve supply, it is mainly supplied by two nerves, that is the recurrent laryngeal nerve and the superior laryngeal nerve. Now, first we'll talk about the recurrent laryngeal nerve. So, the recurrent laryngeal nerve, it arises from the vagus. The right recurrent laryngeal nerve, it arises from the vagus at the level of the subclavian artery, hooks around it, and then ascends between the trachea and the esophagus. While the left recurrent laryngeal nerve, it arises from the vagus in the mediastinum at the level of the arch of the aorta. It hooks around it and then ascends to lie in between the trachea and the esophagus. And we need to know, thus, the left recurrent laryngeal nerve has a more longer course, which makes it more prone to paralysis as compared to the right one. And this is very important to know, because while performing surgeries like thyroidectomy, talking about the superior laryngeal nerve, it arises from the inferior ganglion of the vagus and then descends behind the internal carotid artery, and at the level of the greater conva of the hyoid bone, it divides into two branches, the external and the internal laryngeal nerve. The external laryngeal nerve, it supplies the cricothyroid muscle, while the internal laryngeal nerve, it pierces the thyrohyoid membrane to give sensory innervation to the larynx and the hypopharynx. So simply talking about the nerve supply, that is the motor and the sensory supply of the larynx. First, the motor supply. All the muscles which move the vocal cords, that is the abductors, and the tensors, they are supplied by the recurrent laryngeal nerve, except the cricothyroid muscle, which is supplied by the superior laryngeal nerve, that is the external branch of the superior laryngeal nerve. The sensory supply of the larynx, above the vocal cords, the larynx is supplied by the internal laryngeal nerve, as we have discussed before, which is a branch of the superior laryngeal nerve. And below the vocal cords, it is supplied, the sensory innervation is from the recurrent laryngeal nerve. So thank you everybody. This was all about the anatomy of the larynx, including the basic points we all need to know. And if you like my videos, do subscribe my channel, Dr. Otorhinolaryngologist, or you can follow on my Instagram account, that is the ENT Doc 2026. Thank you.